Thanks everyone for being here, and thank you to Pablo for inviting me. As I said, I'm a professor of social work here at the university and based in the Department of Sociology. And there are three things I want to cover today to kind of unpack the title of this brief talk. First is, what is contextual safeguarding? It's probably quite important that everybody knows what that is. Before I can say why it is something that is relevant to businesses more generally, but specifically in respect of work that we're starting to do with those based in hospitality and retail organisations, and outline what some of the current activities and opportunities have been to take that work forward. And actually, I want to start this with a bit of a health warning. A lot of what I do, I'm a professor of social work, is quite difficult content. So if anybody does need to leave at any point and step away and stop listening or put in headphones or zone out for a bit, that's absolutely fine. I won't be offended at all because it can be quite difficult stuff. But I am a solution-focused person, and contextual safeguarding is about how we improve things rather than complaining about how difficult things are. So I also hope, if people are able to listen to this, that it will give you a sense of hope. So what is contextual safeguarding? Well, it's based on a tricky situation that is not unique to the UK, but most of my work is focused in on the UK, although increasingly is being tested in other parts of the world. And it's a situation based on the fact that as young people get older, they increasingly are exposed to harm beyond their family home. Our child protection systems around the world are largely designed to protect children, the small number of children who will come to harm by those responsible for their care. But as children get older, particularly as they transition to secondary school, they're increasingly exposed to harms that are beyond their front door. And these are harms that are largely caused by their friends, peers, and other adults who their parents don't know anything about. Their parents and carers don't know who these adults are. And these harms often take place in contexts that are far away from parental supervision. They happen in schools, they happen in transport hubs, they happen in shopping centres. And we're largely thinking about situations where young people are exploited, sometimes to distribute drugs across the country, sometimes for sexual purposes. Young people who experience theft of their property, mobile phones, clothing, sometimes with the use of violence or the threat of violence, and young people who are exposed to physical, sexual or emotional abuse from their peers while they are in school, or from their first boyfriend or girlfriend when they start experiencing romantic relationships. Now, for a long time, these harms were seen as out of scope of child protection systems and really out of scope of government responsibility. These were, if they occurred, issues that young people kind of got themselves into and needed to get themselves out of. But over the last 15 years, we've seen an increasing social and political concern for these issues, and then a recognition that the systems we would normally use to deal with the abuse of children were never designed to respond to these issues. These systems that we would normally use, our child protection system, social workers, they are designed to protect children from harm caused by their parents and carers. And social workers would traditionally go to somebody's home, speak to their parent or carer, and assess whether their parent or carer was doing everything they could to keep their child safe. But actually, in most of these situations, parents are doing everything they can to keep their children safe and are often at their wits' end about what to do for their young person. So that way of doing social work falls short, even though we still live in a society where when things go wrong for young people, we generally think, what were their parents doing? Where were their parents? I blame the parents, until you become a parent of a teenager and you realise actually it's a bit more complicated than that. And you can do all you can, but you actually also just hope that when they go through that front door and they get on that bus, or they walk that journey, or they go to that shopping centre, or they go to that youth club, or they're in that classroom, that they'll be okay. And actually for some parents, that hope is not enough. So contextual safeguarding was introduced initially as a concept, then as a kind of conceptual framework, and then as an operating model to try to resolve that tension, and was based on a review of 9 incidents that I reviewed for my doctoral work a number of years ago now, where young people did come to severe harm beyond their family homes. And I was reviewing the cases and thinking, why do these social workers keep talking to these children's parents? They've said they don't know what to do. Why do they keep coming back to them? And importantly, why do they stop all support if parents are protective? Why is no one else helping? So contextual safeguarding as an idea then is made up of 4 things. It says if we want to keep our children safe in any context where they might come to harm and not just in their family home, we need systems that can do 4 things. We need a system that can target the context where the abuse happens. So if a child's abused in their family home, that's where you target. If a child's abused in their peer group, that's what you target. If they're abused at school, that's where you target. You target the bus stop, you target the shopping centre, you target wherever they come to harm. And as the previous speakers noted, that might sound like common sense, but actually it's not that common, particularly when your system is never designed to do that and your culture is not designed to recognise that. We live in a culture that's, as another speaker said, very individualistic, and when it comes to the welfare of children, very focused on parenting. So it might feel like common sense to target wherever the harm is, but actually our system was designed to target parents. So it requires an entire redesign to be able to do anything different. The second part of the framework is its legislative basis. So historically, when we target anything outside of family homes, we do that through a kind of a policing agenda. So I'm sure a lot of you have heard of antisocial behaviour, and a lot of these children would have been described as antisocial. And so the intervention, the legal underpinning of the intervention would be framed as an antisocial behaviour intervention. About 10 years ago, people used to put mosquito sounds in like transport hubs and outside fast food restaurants that only young people could hear because your hearing changes over time. So it would be painful for them to stand around those places and they would move on. And that is very much assuming they are the problem, the young person is the problem and we don't want them around. So we design them out of our spaces and places. And that's all supported by an antisocial behaviour agenda. In a contextual safeguarding agenda, you say, no, we lead from a welfare base and we use enforcement and policing as part of that, but it's not what characterises everything that we do. So whether a child's abused at home or they're abused at school, they will always receive a welfare-based response first and foremost. And if we also need to use enforcement, then we will do so. But that requires a new set of partnerships. And this is where business has become really important, because to do that, social workers need to be working in partnership with people who can actually influence the context where young people are coming to harm. So their partners then become transport hub managers, shopping centre security staff, bus drivers, youth workers, park gardeners, dog walkers, wider residents, community leaders, young people themselves, their families, they all become key partners in the delivery of this kind of safeguarding system. And finally, the system measures its impact not just on this individual child, but on the context where they came to harm. So you don't just ask, is Sarah any safer now that we've done this intervention? We want to know, is the shopping centre where she was groomed and exploited any safer? Or have we taken Sarah out of that situation and another young person has taken her place because the harm still exists in the shopping centre? So you want to know, is the context any safer, not just any individual child that's come to your attention? So that, in short, is contextual safeguarding. It's any response to harm beyond families that targets the context where that harm is happening as a child protection and child welfare issue in partnership with those who can create safety in those contexts, and where you measure the impact of what you've done on the context and not just on an individual child. And since 2017, we've had the privilege of testing this work in partnership with local areas across the UK and seen what happens when they try to redesign their systems. And when they try to do this, a number of things start to happen. First is professionals from lots of different sectors will start to talk about the different weight of influence that contexts have on young people's safety. So they'll sit down and they'll look at an assessment of a young person and they'll say, okay, for this young person, school is the most unsafe context, followed by their peer group. What's happening in their family and in their neighbourhood is less relevant. So is our plan targeting their school or their peer group? Or have we just put this parent on a parenting course, because that's what we do with all parents, and their school and their peer group remains unsafe? Because traditionally that is what we would see. If we read a good assessment in these situations, you'd have a lot of information about the context where they were unsafe, but the plan always targeted the parents. So you weight the context, how influential are they, what's influencing what. In this visual, the peer group was influencing the school was influencing the peer group, which is why they're overlapping in the largest boxes, but the peer group was then also impacting safety within the family because the parents were struggling to support their child because of the influence that the peers had on them, which is why those boxes overlap. And so social workers and those they were working with had to say how they're going to target the peer group in the school, and are they going to be able to make those contexts any safer. Now, to do that, we change what we mean by safeguarding being everybody's business. That's kind of been a statement in the UK for a long time, since working together to safeguard children was introduced as a policy framework. We'd all say it's everybody's business, but what we really meant was it's everybody's business to have a policy and look out for any young person who says there's something going wrong. And if you're the unfortunate person they choose to disclose to, you've got to make a referral. And then once you've made your referral, once you've picked up the phone and you've told that person what you've been told, your job's done. And you can breathe a sigh of relief. And that's what it is your business to do. But actually, you're just referring that child into a system that was never designed to support them in these situations, and it doesn't actually create safety. So for safeguarding to be everybody's business in these situations, it's everybody's business to create safety around young people, not to refer them into an invisible system. If I have the concern about welfare of children in my school, and I pick up the phone and I refer those children into children's services, it's likely that there'll be a discussion about what's happening in my school. And my responsibility will be around working to resolve that, because I influence my school. The social worker that never visits my school has very little influence over what happens there day to day. If I have a concern about children being groomed at my transport hub, the plan is probably going to involve me because I manage the transport hub. Referring a few children into a system is not going to create safety in my transport hub. And when partnerships start to work like this, they try to create change at two levels. So at the first level, they're thinking about how they're individually supporting young people. So when they're assessing a young person's needs, this young person's been assaulted at school, this young person's been assaulted at a bus stop, they won't just say, what do you need? What type of child are you? What vulnerabilities do you have as an individual? They'll try and work out where that young person feels safe and where that young person is unsafe. And they'll often give them a map of their local area, or sometimes a map of their school building if they're unsafe at school, and ask them to hotspot that map. Where are their red zones where they feel unsafe, their amber zones where they feel neutral, and their green zones where they feel safe. To work out, why is that a safe place for you? Can we replicate that in lots of other areas for you? Do we understand what helps you to feel safe? And also, if you found a red zone, what is it that's making you feel unsafe? Or at the very least, are we asking you to attend a support service or an intervention in a red zone and then blaming you when you don't go there? Or do you have to travel through that red zone to get to school or to get to college? If you do, and you're not going to school or college because you feel like you can't safely get there, can we walk the route with you? Can we find a green person for you in the red zone that you have to travel through? Is there an alternative route that you have to take? So the safety mapping work helps professionals think about creating as much safety around the individual young person as possible, and not placing them in harm's way by requiring them to go through areas that they identify as red. But the more that areas work like this, the more they identify actual red zones, which is where you see the level 2 work, which moves beyond working with individuals and start to work with context itself. 3 of our young people that we're supporting have all identified this high street as a red zone. In those situations, social workers with youth workers and other professionals will go into the red zone and try to assess what the young people there need. What is the quality of the guardianship available to them? So who are the adults, and do young people trust them? And what are any of the environmental or community factors that might be creating risk or minimizing safety in that context? And then they can plan around that. So if there is low guardianship, the plan will be to build guardianship. If the issue is that young people's needs can't be safely met, then the plan will focus on how best to meet young people's needs. And to give you a classic example of this, we've seen young people often congregate in fast food restaurants because of the free internet access. Now, historically, and the fact that we have no youth clubs left. It's kind of a combination of both of those things. Now, the offshoot of this often was that young people were being targeted for the purposes of exploitation in fast food restaurants because it was an easy access point for adults who wanted to do that. And all you really had to do was walk around and offer to buy children chips and see who was hungry and didn't have any money. One young person would say yes, and then they were indebted to you. And then you would have an escalation quite quickly into requiring that young person to do other things for you. Now, to get young people away from the fast food restaurants, because often fights broke out and there was drug dealing and things would be going on that other residents didn't like and didn't appreciate and the managers didn't like, the internet would be switched off. Because if the internet was switched off, young people would stop spending time in the fast food restaurant. But what we would then see would be the displacement of those children into other unsafe settings. And again, you just needed an adult lurking around to say, come and use my flat instead. Because the need was often children who didn't have internet access at home. So switching off the internet access just meant their needs were now unmet. And they were even more unsafe than they were when they were doing their homework in the fast food restaurant. Some children didn't have a bedroom at home, didn't have places to socialise with their friends after school or at the weekend, so they would huddle there. So that need's now not being met. They need somewhere else to go. Who's going to offer them somewhere else to go? So it's really important to think about need, then to think about who the protective adults are, and to understand the wider environment, overcrowded housing, poverty, and so on and so forth, that can drive demand and therefore vulnerability into these spaces. So what does this type of thing mean for businesses? Well, I've given you an initial example there. We know that contextual safeguarding is highly relevant for different businesses because of their interactions with young people. But the more we've had this conversation with businesses, the more we've understood it to play out in a slightly more complicated way than we first assumed, because a lot of businesses want to talk to us about their staff because their staff are young people. And despite what our legislation may say, in terms of childhood ending when you wake up on your 18th birthday and all of a sudden you're an adult, we actually know from brain development that we remain adolescents really until we're about 24, 25. And adolescent development extends far beyond our kind of child protection legislative framework. A number of businesses, particularly in hospitality and retail, employ vast numbers of adolescents. And so their concern is not just for their customers who come in and are young people, but is also for their staff, many of whom are young people. So they're thinking about the journey that those young people are making to and from work, the context of the workplace itself and the relationships between staff, as well as between staff and customers, and the interaction of their workplace with other local contexts, like a local college, where there may be issues playing out in the college that then spill into the workplace. And we've seen that with sexual harassment between staff members in a workplace being mirrored in terms of sexual harassment that's been normalised in the college, and things are happening back and forth. But then we also do think about the customers, as I've been said, again, many of whom are young people. And these are contexts where they may also come to harm, but also where they are seeking safety, where they go to socialise, to have their needs met, to be teenagers. And adults, therefore, might be using this place of business to access those young people. The young people are not the problem, it's how the business is utilised to access them. And so when we look at businesses, they actually hit all 3 points of that triangle that I had up earlier. They meet needs of young people, they have opportunities to provide proactive guardianship, there are protective adults around those young people, and they are environments where harm can escalate or where harm can be reduced, where safety can be increased or where safety can be undermined. And so we see this play out in many of our test localities for contextual safeguarding. In one of them, in one of the early days, we were doing a location assessment of an area where a young man's home had been shot at, and there was a suggestion by the social care team to take him into care and move him a distance from the family home for his own safety, but he didn't want to go. He didn't want to leave his parents, he didn't want to leave his siblings, and he said if he was moved, he was going to run away from that placement. So there was discussion about could they make it safer for him to stay at home, or they tried to de-escalate some of the tensions in the area. And during that time, they were surveying local businesses in the vicinity of that housing estate to see whether there was any active guardianship happening or whether any of them had noticed anything going on. And in one of the chicken shops, the chicken shop owner said, oh yeah, all the time, but whenever fights break out, I just give out free chicken wings and it kind of de-escalates the situation. And he was doing incredible guardianship. And young people were going in there when they needed to just be safe for a minute and then would wait and go on. But he was doing that without any support from the local infrastructure whose responsibility it actually was to provide safety for young people. And without that location assessment to really understand what was going on, the social workers, the youth workers were missing an opportunity to really understand why young people went there to be safe, and that there was an adult there that actually really liked teenagers and was trying to support them in ways that didn't criminalise them. What he wasn't doing was phoning the police every time that there was a bit of an argument. He was trying to de-escalate the situation and support those young people to be safe. And in another completely different part of the UK, we saw concerns build over the summer holiday, where there's beach setting, and we saw increased number of adults on the beach during the summer holidays, an increased number of young people being found drunk and intoxicated on the beach late at night. And there were concerns about adults filling up the place, flooding the place, who practitioners really didn't know and young people didn't know. And there have been a number of complaints about sexual assaults. Now, there was a whole raft of work that happened in the beach area to address some of those issues, including the use of youth workers. But what they also did was work with the local businesses to identify anyone that was willing to be a safe haven for those young people if they needed to go in and access help. And what they did through consultation with the young people was to develop a QR code that the young people could download on their phones, so they could quickly identify any business in the local area that they could go and access, rather than look for stickers in everyone's windows, which was quite time consuming. And young people also didn't want there to be a big sticker saying, "We're a safe haven, come into us." Now, in both of these situations, the people involved, the businesses involved, liked young people. It's quite a fundamental thing that we often forget. There's been lots of training for businesses on risks outside of the family. And the problem with some of it is it also assumes that everybody likes teenagers. And if we're being honest, a lot of people do not like teenagers. So just training them to be aware of these issues can actually just put people off having teenagers anywhere near their business. So it's really important to identify businesses who have a caring intention towards young people, who like young people, and who understand the local context that they operate in and recognise that they can provide safety but can also be open to risks. Those businesses were connected with wider partnerships such as schools and children's services to support them to engage in this endeavour, and all of them frame these issues as child welfare and safeguarding issues rather than an issue of antisocial behaviour, which required a lot of work from a policy perspective, because a lot of the support they got was from business and the community work, which was often around antisocial behaviour, and they weren't connected into local safeguarding structures. And in both scenarios, young people were asked their view and were really being followed by what young people said. Young people were self-selecting into the fast food restaurant. So that's where we went. And in the second one, they suggested the QR code, so that's what was used. So what are the opportunities for taking this work forward? Well, we do anticipate national reforms to safeguarding guidance over the next 18 to 36 months, following an inquiry into children's social care. And this will likely increase requirements on all child-facing and child-serving organisations, not just the traditional ones, to think about their role in creating safety for children and young people. So we have an opportunity to get ahead of those reforms and ensure they're actually workable. And we are, as a research team, therefore, currently engaged with a number of national and multinational businesses who are interested in exploring contextual safeguarding and implementing it across their workforce. As part of this, we've recognised there's a real opportunity to ensure developmentally appropriate support pathways for adolescent staff. We've really been interested at the lack of expertise on adolescent development within retail and hospitality, and actually how important it is to know why young people behave the way they do, and it's actually developmentally appropriate to want to take a risk, to only think about the weekend, to be emotionally all over the place because of puberty, and to have an increasing desire to just do what you want to do and not what adults tell you. As frustrating as some people might find that, and youth workers love it, so it is definitely, it waxes and wanes between sectors, that is a teenager. And I can say that at the moment because my eldest is only 7, and I know when it comes, I'm going to feel less confident, but that is a teenager. So how we work with the opportunities that come with that age group and ensure that our support to staff and to customers is developmentally appropriate is a real opportunity in the sector. And that also requires new relationships to be built between businesses and local safeguarding partnerships in situations where businesses have largely relied on community partnership structures. But it should ensure that we are working towards creating inclusive business environments for young people who are both staff and customers, and really work on how we build contextual interventions to create safe spaces in partnership with those who run those contexts. So I hope that's been a helpful introduction as to why contextual safeguarding is relevant for businesses. Please do stay in touch if you want to know more.